Ask the Expert. Doctors, patients, and medical administrators across the country will observe National Nurses Day today.
Yeah, the annual week-long celebration honors the contributions made by nurses around the nation. Dr.
Jennifer McKinnon from the Medical College of Wisconsin joins us today with her nurse, Caitlin Iserloth. How are you guys? So tell us how this partnership works in the clinic.
In our internal medicine clinic at Freighter, we see a lot of complex patients, and the nurse is the key to our team approach, because with nursing, they can handle a lot of our phone calls, secure emailing that patients can do, and handle the upfront and be the touch point for the patients when they can't reach me. And what I see when I see them, it's a 20-minute visit, and there's so much care that needs to happen in between the visits.
So teamwork is always a good thing. Caitlin, what do you like about the job? What does it bring to you?
You know, the internal medicine, it's a great clinic. We work with patients who range from 18 years old up to the geriatric population. And we really have a great team approach in the clinic. Most of our patients have very complex medical histories. And as nurses, we're responsible for answering any questions in between, relaying lab results to patients, medication changes, doing a lot of education, and then we put through referrals and help coordinate with specialists.
So a lot of communication.
Yes, a lot.
Between the two of you, or mainly the three with the patient itself, or herself, him or herself?
I would say most of the nurses in our clinic spend most of our time on the phone triaging patients. They'll call us with their symptoms. We'll look at lab results, medical history, what medications they're on. And then from there, we'll make a recommendation. Do you need to be seen urgently in the ED or the urgent care? Is this something you should come see your primary about, or can we manage your symptoms at home? From there, we'll send a message to their primary doctor, and then they'll get back to us for further follow-up, such as medication changes, and we'll call them back.
Dr. McKinnon, what would you do without Caitlin?
I would not be able to function. The amount of phone calls we get and emails now is overwhelming in many ways, and without having a nurse right there to help manage patients, to keep them out of the hospital especially, would be really difficult.
So how do you navigate through that, knowing that maybe a lot of patients want to talk to you, but it's important to talk to Caitlin as well to get to you?
Yeah, she handles that. Her expertise as an RN is just invaluable. And then I do speak to them if I have to.
Yeah.
Best part of the day?
Best part of the day? Well, you know, I love how you really get to know the patients, especially in an outpatient clinic. You recognize them as they're calling in, and they get to know you because you can go introduce yourself in the clinic, and you really just get that, you know, relationship. You get to know them as a person, and it's so fun to see like how interventions can really impact their health. And
so, being that it is National Nurses Day, did Dr. McKinnon do anything to appreciate your help? And
of course, yes.
We're gonna go out.
Yeah, we're gonna go out after this, and
you should be able to find a nice place outdoors.
Yeah,
maybe,
definitely.
Dinner or something. So thank you both for coming in and sharing with us on that. So have a question for our experts, email them at asktheexpert@today'stmj4.com. You can also leave a voicemail. We have the number right there for you.